Hello, I would like to share some information with you in regards to panic attacks. This information is coming to you today from healthguide.org. The authors are Melinda Smith, Lawrence Robinson, and Jane Siegel. So, what are panic attacks? Panic attacks are intense waves of fear characterized by unexpectedness and immobilizing intensity. Your heart may possibly pound, you can't breathe, you may feel intense feelings and/or thoughts. Panic attacks often strike out of the blue without warning and sometimes with no clear trigger. Panic attacks may be a one-time occurrence, although people experience repeated episodes. Reoccurring panic attacks can often be triggered by specific situations, but not always. Usually, the panic-induced situation is one in which you feel endangered and unable to escape, triggering the body's fight or flight response. You may experience one or more panic attacks, yet be otherwise perfectly happy and healthy. Or your panic attacks may occur as part of a mental health disorder in which support from your mental health provider would be of assistance. Regardless of the cause, panic attacks are treatable. They are strategies that can be used to help in reducing and sometimes eliminating the symptoms of panic, regaining your confidence, and taking back control. So, some signs of panic attacks can be shortness of breath, hyperventilation, heart palpitations or heart racing, chest pain or discomfort, shaking, choking feeling unreal or detached from your surroundings, sweating, nausea, feeling dizzy, lightheaded, numbness or tingling sensations, hot or cold flashes, losing control or feeling like, something's not right enough. So some self-help tips for panic attacks. No matter how powerless or out of control you may feel about your panic attacks, it's important to know that there are things that you can do to assist in helping yourself. Some steps, some techniques can be learning about panic and anxiety. Simply knowing more about panic can go a long way towards relieving your distress or feeling distressed. With the assistance of a mental health provider, you can explore, process feelings, thoughts to aid in identifying triggers and implementing coping skills and strategies. Avoiding smoking, alcohol, and caffeine. These can provoke, not always though, panic attacks in people who are susceptible. Learning how to control your breathing. Hypoventilation brings on many sensations, such as like lightheadedness, tightness of the chest, that can and may occur during a panic attack. Breathing deeply, on the other hand, can relieve the symptom of feeling panicked. By learning to control your breathing, you can calm yourself down when you're feeling anxious and or panicked. If you know how to control your breathing, you are also less likely to create the very sensation that you are afraid or in fear of. So practicing relaxation techniques. When practicing regularly, these activities like yoga, meditation, can strengthen the body's relaxation response, which is the opposite of the stress response involved in anxiety and panic attacks. And not only do these relaxation practices promote relaxation, but they also increase feelings of joy. And then there's also exercising. So exercising is a natural anxiety reliever, possibly trying to move your body at least 30 minutes on most days. 3 10-minute sessions, that's just as good as well if you are able to. Kind of moving your legs, your arms, dancing can be effective. Getting enough rest. So, insufficient or poor quality of sleep can make anxiety a little heightened. So try to get 7 to 9 hours of restful sleep a night. If sleep is an issue or problem, a concern for you, please also speak to a mental health provider that can provide support for you. So treatment for panic attacks and panic disorders. So the most effective form of professional treatment for tackling panic attacks, disorders are therapy. So even in a short course of treatment, that can be of assistance. So while there are many treatment modalities, I would like to focus on CBT. So CBT is cognitive behavioral therapy. So focusing on the thinking patterns and behaviors that are sustaining and triggering your panic attacks, and it kind of helps you with your fears and normalizing those responses. So while you may have to seek the support or kind of change the thinking or thought patterns with the distress, they will become less terrifying or more manageable. So for individuals that has experience with someone that they love, a loved one, friend, family member, someone in their support network, experience a panic attack, that can be frightening for the person that is there to help, right? So some tips for individuals that is seeing a friend or a loved one that is suffering from a panic attack. Staying calm, being calm yourself, understanding and not judgmental will help your loved one balance and subside quicker. Focus on your loved one's breathing. Find a quiet place, if you are able to, for that person to sit with, and then guide them, take them to a slow, deep breathing repeatedly for a few minutes. That will be of assistance. If they are able to, as well as yourself, maybe doing something physical, raising and lowering your arms or stomping on your feet. It can help burn off some of your loved one's stress. Encourage your loved one to seek assistance. So once the panic attack is over, your loved one may feel embarrassed about having the attack in front of you. Reassure them and encourage them to seek help for their anxiety and or panic, such as a mental health provider, a counselor, a therapist, psychiatrist, a psychotherapist, a licensed counselor, and their otherwise. I hope this information was helpful, and have a good remainder of your day.